Hey friends, welcome into Nurse Like a Boss, and today we are going to dive into baseline fetal heart rates made easy. If you're a nursing student or you're new to labor and delivery, one of the first things you need to do is learn how to interpret a fetal heart rate tracing. And we do this by starting with the baseline. The baseline is the very first thing that the nurse looks for when she's assessing a fetal heart rate tracing. Okay, guys, so my disclaimer here is that I am a nurse. I have worked in labor and delivery, postpartum, and level 3 NICU. I am also a clinical instructor and I am a parental child birth educator. However, I am not your teacher, okay? I'm not your instructor, and I'm also not your preceptor on the unit if you are new to labor and delivery. So I just want to say that because you should always go with what your textbook says or what your teacher says because we need to pass the test. Okay, we need to pass the test. So that's what we're doing here. But I'm going to teach you what I know because I have taught electronic fetal monitoring and I feel like I'm pretty decent at it. And I feel like it can be easy. And we're going to do that and make it easy for you today. So the fetal heart rate is super duper important, right? We are evaluating the baseline first and foremost because it can tell us a lot of things, right? So we aren't just looking for a number. We are looking for a number, and now we are going to take that number and see how we apply it to our clinical picture today. Right. So it can tell us about how well the fetus is oxygenated. It can tell us whether or not mom has infection. It can tell us if there's some medications on board and baby is reacting to that. And it can tell us if the baby is in distress. So that's why we need to get a good fetal heart rate. To obtain a fetal heart rate, we need a 10-minute strip. Okay. We need 10 minutes in order to establish a baseline. So we just said we needed a 10-minute strip. The way that you count out your strip is by looking at these boxes. So if you zoom in, you can see that I've drawn red boxes around these squares. These are 60 seconds or 1 minute. If you look where the lines are very bold, you can see that those are minute blocks. Each little individual block is 10 seconds, and we're going to show you what that looks like in the next slide. This is just an example. It's only a 7.5 minute strip, but I wanted you to kind of see what it looks like. You see the bold lines, and then you see I have the number 1, 2, 3, and so on in between each bold line. So those are 1 minute blocks or 60-second blocks. And you can see that there are 6 little squares within those boxes. Here's a different tracing, and I'm hoping that you can see it a little bit better, but you can see those lines are very bold. And in each one of those bold squares, I have numbers. So it's 1 minute, 2 minute, 3 minute, 4 minute, 5, and so on, right? So this is only a 5-minute tracing. But you can see in the box that I've drawn above, I've ticked off 6 boxes, and those are 10-second boxes, okay? So that's number 1 is 10 seconds. Number 2 is 20, 30, 40, 50, 60. Does that make sense? Let me know in the comments. When obtaining your fetal heart rate baseline, you want to exclude accelerations, decelerations, and marked variability. Now, we will go over these in separate videos. However, I will touch on them so that we can make sure that you are comfortable and confident when obtaining your baseline in this module. In healthcare, we like to say that you should know what normal is, because if you know absolutely what normal is, then you'll be able to identify when something is abnormal. The normal baseline fetal heart rate is anywhere from 110 beats per minute to 160 beats per minute. Anything less than 110 beats per minute is fetal bradycardia, and anything greater than 160 beats per minute is fetal tachycardia. Again, this has to be evaluated over a 10-minute window. And just in case you're not good with your less than and greater than signs, I did write it out for you to refer back to. Let's pretend that this is a 10-minute tracing. And I put this up here because I want you to see where your 110 falls and then where your 160 falls. So I blocked out your lower limit at below 110, and then you have your upper limit, which is above 160. And that's it. That is your window. You have a very small window to work with. Anything above 160 is in the attic, and anything below 110 is the basement. We don't like it outside of those parameters, okay? We want to stay in the main part of the house. So that's that parameter right there. You really only have about 50 beats per minute to work with when you're talking about a normal fetal heart rate baseline. So let's dive into learning how to actually obtain the fetal heart rate. I'm keeping the red box on the screen to represent that 60 seconds or 1 minute just for reference and reminder. So the boxes above the white space is where the fetal heart will be. And sometimes you will also see the maternal heart rate there if mom is wearing a pulse oximeter. Below that white space are the contractions. Let's ignore the contractions for now and focus on the heart rate. Above the white space, you'll see the number 30. That stands for 30 beats per minute. The next line up would be 40. The next line up would be 50. And the next bold line you'll see is 60. Off to the left, you'll see the red tick marks. And I started marking at 110 because that's as low as our normal baseline fetal heart rate should be. So let's go over to the left. The next tick mark up above 110 would be 120, where it is a bold, solid line. The next line up would be 130. The next line up would be 140. And then the next line up would be 150. And you can see that printed on the strip there. So again, each line is a multiple of 10. Inside the boxes, we are using multiples of 5, okay? So you can see on the screen that I have inside the box 125. Then we skip over the line and go into the other box, that's 135. We skip over the line and go into the next box, that's 145. So you see what I did there? Let's take a closer look. As you can see inside the boxes, I went by multiples of 5. And then on each line, I was going by multiples of 10. So it reads on the line 120, in the box 125, on the line 130, in the box 135, on the line 40, and so on. As a reminder, fetal tachycardia is a fetal heart rate greater than 160. So automatically when I approach this tracing, I go right to the 120. I see what I like. I love me a good 120, and I see my fetal heart rate is nowhere near there. So then I go up and I see the next bold line is identified as 150. And then I count up from there, 160. 170 line, and now we are landing at 180, which of course, as we said, anything greater than 160 is tachycardia, and that is the case here. And we also have fetal bradycardia, which is a heart rate less than 110 beats per minute. So you can see here, again, I come in, I'm looking at 120. My baby's heart rate is nowhere near 120. And so then my eyes go down and I see a line that goes to 90. Then we drop down some more, right? And we're at 80, 70, 60. And then we finally end up at 50, which is super scary. Yes, you should be extremely concerned. The solid lines are going to be your multiples of 10, and inside the boxes are going to be your multiples of 5. So you guys are almost there. We are going to go ahead and walk through these tracings together. Step 1, we are obtaining that 10-minute tracing. I don't have one, but we are going to pretend that we do, okay? So you want to count your boxes to identify your 10-minute tracing, all right? Step 2, we are going to ignore any accelerations and any decelerations. So just cross them out, act like you don't see them. Step 3, where on the entire page does your fetal heart rate line hover? Where does it sit most of the time? So now pause and you give this a try. Let me know what you think the baseline is. I'll give you a hint. It's outlined in red. Let's walk through it again together. Our 10-minute tracing, check, we have it. Do we have any accels? We do. Let's ignore it, cross it out. Do we have any decelerations? We don't, right? So number 3, where does our fetal heart rate sit most of the time? I would say 140 beats per minute. But if you said like 145, that's okay. No one's going to come to you and say, you got that wrong. It was absolutely 145. No, it can be 140. If you see 145, it's around there, right? But it isn't like 120 and it's not 160, right? If you said any of those, that would be incorrect. And I wouldn't expect a test that you take to hover so close together. I would expect them to give you something that's a very obviously wrong answer and something that is right. Again, let's walk through this one together. We're looking for our 10 minutes worth of tracing, right? And we have that here. Work with me. Then we are going to look for accels. Do we have any? I don't see any. Do we have any decelerations? We do. We're not going to pay attention to those right now, right? We are going to cross those out and we are looking for where our baby's heart rate sits most of the time. And when I look at that, I see 150 beats per minute. Is that what you got? Oh my gosh, friend, you did it. You now know how to find your baby's fetal heart rate baseline. Congratulate yourself. I know it was a little tough, but you did it. Let me know if you have any questions down below. Make sure you write down these 3 steps, take them with you, and you'll be golden. If you found this video helpful, then you'll want to stick around for the next video, which is going to be on fetal heart rate variability. Okay, that's a tricky one. It's one that always gets people in trouble. So we're going to rock it out together and you'll be just fine. I promise. Make sure you like, comment, share if you know someone else in nursing school and you found this helpful, or if you know someone that's new to labor and delivery and they want to give it a shot. All right, bye.